This is the Motherlands podcast. The intention of this podcast is to provide evidence-based information through honest conversations on fertility, pregnancy, birth, postpartum, and beyond by bridging together the two worlds of allopathic medicine and holistic practices to improve the reproductive health outcomes of women. I am your host, Keely Semler. Hello, welcome back to the Motherlands podcast. There are a lot of new developments I wanted to share with you as we grow in community together. The first thing is that I will be hosting an online deep dive session on medical informed consent. I'm very excited to offer this, especially because this is something that comes up daily with clients. What is medical informed consent and why should we care? I think it's important for people to understand their own power in making medical choices that are right for your individual body. When it comes to pregnancy, you're already in such a vulnerable state that it is truly invaluable to feel educated and empowered leading up to labor and birth. This is why this deep dive session on medical informed consent is so important. This session is open to anyone, but will be especially geared towards fertility and pregnancy. So whether you are currently pregnant, or you know someone pregnant and want to support them, or you plan to be pregnant someday, this is for you. Also, doulas are welcome to join as well, as it is important for doulas to understand how medical informed consent works in order to best support their clients, especially in a hospital setting. The session will run about an hour. So bring your questions, feel free to invite anyone who may also benefit from this discussion. It's going to be on Sunday, April 21st at 10 a.m. Pacific Standard Time. If you can't attend live, you'll be emailed the session and you can watch it whenever you have the time. There's a link in the show notes to sign up, and you can use the discount code MOTHERLANDS for 10% off the live session. I'm really looking forward to connecting with you all there. This next guest is an incredible practitioner and educator. Allison Oswald is a physical therapist that specializes in pelvic wellness. Oswald takes a personalized and holistic approach to women's wellness, integrating different modalities such as pelvic mapping, manual techniques, visceral mobilization, and movement education. She supports women who are pre, mid, or post-pregnancy or experiencing pelvic pain, incontinence, or pelvic injury. We discuss when exactly does pelvic floor health become important in a woman's life, and how she supports women with connecting and understanding the pelvic floor as it relates to the rest of the body. In fact, there are specific areas of the body, like the jaw or the back, that we can draw our attention to that can have an impact on our pelvic floor. Allison's unique approach to educating women and applying it to their daily lives is refreshing and extremely practical, especially for new mothers. I hope you enjoy this episode, and if you love it, please rate and leave a review. Thank you so much, and see you again soon. At what point in somebody's life does pelvic floor health become important?
Great question. It depends. It depends on each person, but it actually is something that I believe it's kind of never too early. I mean, even though men have pelvic floors as well, but I only work with women, girls that are going through puberty, like get to know what the pelvic floor is. I mean, sex education in general stinks for a blanket statement, but pelvic floor should be a part of that conversation because there are many young women who have pelvic floor dysfunction, such as, high intensity athletes maybe that aren't getting a period or that have pain in their pelvic floor, or, sometimes with gymnasts or horseback riders, we see pelvic floor dysfunction show up. In my practice alone, sometimes I'll have women, the entry point is typically around pregnancy because a lot of people start to think about their pelvic floor at that time, but it's not just for pregnancy or postpartum, it's for women across the lifespan because the impact that the pelvic floor has on our whole body and vice versa. It's really interesting, but I have women that come and they're like, oh, well, I've always had, let's say, constipation. It's just kind of my thing. It just, I have trouble with X, Y, and Z. When I was 12, I fell off my bike and I hit my pelvic floor, and we go to do an exam and their tailbone is shifted to one side. And it's probably from that impact. I mean, that's one of our big questions. Have you ever fallen on your tailbone? And that's because the muscles of the pelvic floor attach to the tailbone. So it makes a big impact. So the entry point is whenever you're ready, we'll take you anytime. But pelvic health can be about prevention and about wellness. And so I think as a pelvic floor practitioner, I'm always just trying to teach that, you don't have to have symptoms to learn about your pelvic floor. Let's get to know yourself and get that body awareness before things come up. Because when you know them, then you know when to reach out for support, or what's not normal, even though it's super common. The biggest time I see women is when they're either pregnant, postpartum, or they have the typical pelvic floor symptoms of pain, of leaking urine, unable to control gas, things like that, or pelvic floor pressure.
Yeah, I feel like there's a lot there that you just said. Really, pelvic floor health has a lot to do with education, and also it's preventive. And I feel like preventive health isn't really something as Americans we really talk about. It's everything's seemingly fine until one day it's not. And then it's damage control. How do we mitigate that? And I think that's really interesting. But something you said, I think, going back to younger women, perhaps before they have children, why is it that high intensity athletes, or you said horseback riders, why do you see that they have pelvic floor potential issues? Why is that?
Well, a lot of young athletes, runners, gymnasts that are doing a lot of activity can sometimes have more pelvic floor tension, more tightness. Everything's all about constricting and making everything very tight. And so sometimes with them, there is a pattern that occurs in the body of tension. And one cornerstone of pelvic floor health is that this muscle group needs to be able to fully relax and fully contract. We need that ebb and flow. We need that movement. I compare the pelvic floor to a trampoline, which is very strong, right? We can step on a trampoline without falling through it, but it's strong because it gives. And it's strong because it propels you up when you jump off of it. There's movement in it. We don't want a muscle group to be rigid, any muscle group in our body, but our pelvic floor definitely is part of that. So that's one reason. And then things like horseback riding, and that's because of the pressure onto the pelvic floor. That's because that can sometimes lead to pain, or that can lead to tailbone pain, which can impact pelvic floor. And really falling, whether off a horse or falling onto a horse or falling off of a bike, like I said, that direct pressure to the pelvic floor or tailbone or sacrum can also impact what's going on in the pelvic floor. And sometimes without symptoms necessarily. Maybe symptoms will arise later, or maybe they won't, or maybe we'll just find an imbalance later. And then we ask that question of, did you ever have any big falls? Was there anything that ever happened where you fell on your butt, or you jumped off a rock into a lake? That pressure into your pelvic floor, that can impact you down the line.
What does a typical pelvic floor session look like with a client of childbearing years but is not pregnant yet? How does that typically go with you?
Yeah, so it's a lot of education, like you mentioned. So first, it's anatomy, pelvic floor 101. PT in general shouldn't be approached, I don't believe, in the thought of, okay, how are you going to fix me? Or how are you going to, take care of me? It's really not. It's how we're going to support you taking care of yourself. And I take that approach very seriously. And so you have to get to know your body first, understand how it functions. So I show a lot of visuals. I show my model. I explain how it's a part of your core. It's a part of your body. And really over my years have zoomed out again and again and again, because I don't just focus in on the pelvic floor muscles. They're one part of this symphony in our whole body. So a lot of education up front. And obviously a entailed history of any injuries, of anything, any surgeries, any past medical history that I should be aware of. And then we do an assessment. And if I'm working with somebody virtually, I'm looking at them and seeing how their body is moving, how they're standing, how they squat, different things depending on, if they don't have any symptoms of pain, then it's pretty straightforward. If they have symptoms of pain, we try to recreate that because we want to know, or not even pain symptoms. We want to know like what's happening, what's not working so great. And then a big part is abdominal assessment, see what's going on with the abdominal wall, and a pelvic floor assessment. So as a PT, we do internal pelvic floor assessment. So if I'm working with somebody in person, I can do this with them. It is, with consent, it is a pelvic mapping of where is the pelvic floor? Where are these muscles? Can you contract them? Can you relax them? Can you coordinate it with your breath? It's super eye-opening. Mm-hmm. Oftentimes, or not oftentimes, but what happens is the assessment turns into the treatment. Because we figure out, okay, you can't feel this right side as much as the left side. So I might do some manual release of there. And then let's try again. Oh, now I feel it. Oh, that's my pelvic floor. Oh, that's how I relax my pelvic floor. It's this elusive place in our body that we can't see inside. So it really takes focus and intention to be like, okay, that's where it is. Now I saw that picture. I saw that model. I can visualize that that's where this assessment is taking place. And if I'm not with somebody, I walk them through a self-assessment of their pelvic floor. And then that lays the groundwork for, okay, what is appropriate for that person? How can they integrate pelvic floor into their daily function? How can they integrate pelvic floor connection into their exercise program? How can they integrate it into their sexual function? What's happening as they go to the bathroom? Are they doing that at a typical normal frequency? And are they pushing or are they relaxing? So the day-to-day activities, we do these so often. We get up from chairs, we go to the bathroom, we have sex. Like we can integrate pelvic wellness and pelvic awareness in all of that, which makes a really big impact. And that is to your point of not waiting for your body to be like, I need help. It turns your brain on to be able to know like, oh, this can't be normal. Time is not just going to heal this pain or that I'm peeing every hour. Like I need to do something about this, and being able to listen to like kind of those little whispers of our body before it starts yelling at us that, we're peeing our pants. So that's really what the session is all about, is making sure I want my clients to walk away with a better understanding of what the heck the pelvic floor is, why they should care about it, and how it functions as part of a holistic wellness approach. Because pelvic floor dysfunction is not just in the pelvic floor. It impacts a lot of other things in our body. We see pelvic floor dysfunction with jaw pain, shoulder pain. We see it with upper back stiffness and difficulty breathing. We see it with hip pain, back pain, foot dysfunction. We know there's a really close connection of our feet with our pelvic floor. So it's a big picture approach, which is why the typical messaging around pelvic floor of, do your Kegels at your stoplight, that's not pelvic floor therapy. That's not for everybody either. It's old. It doesn't make any sense. People don't get it. If you're told, to do a pelvic floor contraction or a Kegel, most people do it wrong. So you really have to have the education and the understanding behind it.
How does someone's mental health or their emotions, how is the pelvic floor impacted by that?
Yeah, great question. And very much so on a few different levels. But the main one is our pelvic floor muscles are innervated by our autonomic nervous system. Our autonomic nervous system is our parasympathetic, sympathetic. We could break that down even a little bit more, but in general, those big categories, meaning that when our body is experiencing stress, could be all types of stress, big stress, little stress, whatever. The pelvic floor is responsive to that. So if we are in a state of stress, we are more in our sympathetic nervous system, our fight or flight, our cortisol is elevated, and our body wants to protect us because it's beautiful and it does that for us. So for our muscles and connective tissue, that means they tighten and they restrict blood flow, right? They're just like white knuckling. So think of that happening in your pelvic floor. And we live in a time where we have stress all the time. And we don't get rid of stress. Like the older, they always tell the analogy of like being chased by a saber-toothed tiger. Back then, like that's where our nervous system, that's why it's developed like this. But after that saber-toothed tiger left, or they were able to get away from it, the stress was gone. Then it was done. Our stress never goes away. Money, relationships, work, all of that is always there. So we need to be able to work through those stress cycles and move stress through our body so it doesn't hold on to it. And the pelvic floor, because of its innervation, can be a place where we hold on to tension. And so it's all about, again, getting back to that trampoline, like how can we get the pelvic floor to completely relax and to be able to contract when we want it to? And that goes back to how do we connect? Because if we can't connect, we never even know if the pelvic floor is feeling this way, is feeling like there's a disconnect to your body. And then away from the nervous system involvement, if you get into the energy of how we hold energy in our body and you believe in the energetic chakra system, our pelvic floor is our root. Our pelvic floor is our connection. It's our feeling of safety. It's our feeling of being able to feel in your body and not rigid and closed off. And so when we aren't feeling like that, if we are feeling threatened in any way, if we're feeling unsafe, and that could be consciously, subconsciously, it could be many generations ago that we hold on to, that's going to impact the pelvic floor as well. So the emotional connection is really huge, and we're discovering it more and more, or legitimizing it more with more and more research, knowing that symptoms of pelvic floor dysfunction can be heightened during times of stress.
It's funny you mention this because I encounter this a lot with my clients in labor and in birth. And something I'll say to a client in labor is, are you clenching your bottom right now? Because sometimes you can see it. And it's hard because sometimes someone in labor doesn't have any awareness that they're even doing that. But when so much is happening physically, emotionally, energetically, when you're giving birth, sometimes just bringing awareness to that part of the body, or even having them gently touch it and say, see, you feel that? Let it go, release it. So that the baby can come down and out. But it's kind of the last thing you want to do.
I know it is. And it's that battle of something hurt, right? Typically, it's not a comfortable experience, and our body wonderfully wants to protect us. So leading up to it, that education, right? That awareness, having someone with you that can draw your attention to it, because sometimes you need somebody to do that for you when you're in that experience, is so valuable. And also because the pelvic floor is connected to so many other areas of our body. I mentioned like the jaw is one of them, the feet are one of them, the hands.
Yeah, talk about the jaw a little bit.
Yeah. So instead of saying like, relax your pelvic floor, they're like, are you kidding? There's a baby coming down here. I can't do that. But hey, let's focus on relaxing the jaw. And then guess what? You don't even have to say pelvic floor. And that helps to let go. So the jaw is connected with the pelvic floor in a few different ways. Some of that through the autonomic nervous system, because these muscles tend to clench when we're under stress. There's also a connection in how the jaw was formed and how the jaw and the pelvis have this structural connection. And then beyond that is the connection of our vocal cords with our pelvic floor. Anatomically, it's like incredible to look at the images. They look so similar. So when we have a relaxed jaw and we're able to breathe through our mouths, then we are in turn breathing through our pelvic floor, which we don't breathe through our pelvic floor, but our pelvic floor is able to open, able to relax, able to soften. So with all those connections, the jaw can be a great place to work on if the pelvic floor seems challenging to get to or frustrating. I mean, it's also, I would assume you see this with your patients, like, what else can we say besides relax the pelvic floor? Right?
Yeah.
Like, well, okay, you're telling me that, but I don't know what that means. So we have to have other language and we have to have other places to get to it. And what works for one person is not going to work for the next person. We want that full body of, okay, let's try this angle or let's try this stretch. And that's really why the big blanket statements and the one size fits all approach just doesn't work for most things. But that's one of the reasons why.
I try my best not to say the word relax in labor.
Isn't it hard?
It is hard, but it's just not a word that people are very receptive to. So softening, loosening, sometimes I'll use analogies like imagining your body melting into honey on the floor, things like that.
The language that describes something visual like that, I have found is super helpful. I was just working with a client who just had a baby, and I gave her this, and afterwards she's like, this was really helpful. Just as I mentioned, you don't breathe into your pelvic floor, but we would say breathe into your rectum so that you are feeling like your rectum is opening and relaxing, which is obviously hugely necessary during a vaginal delivery. And that visual is helpful. And then you're actually like, okay, I can do that, but I'm not relaxing my pelvic floor. But you are.
I'd love to talk to you about pelvic floor health as it relates to pregnancy, because I think that culturally, a lot of women are at least now aware that their pelvic floor exists. But I think that there's kind of like this write-off, like, well, yeah, I'm very pregnant and I just pee all the time, and like I'll deal with it later or afterwards. And like, this is just how it is. I'm pregnant and I'm comfortable. And, so can you talk a little bit about how you support pregnant clients? And another thing before you explain how you work with them is a lot of my pregnant clients will say, or they're so fixated on strengthening the pelvic floor. And again, going back to your trampoline analogy, which I really, really love, how do you kind of refocus their attention on that trampoline analogy of their pelvic floor, as opposed to just fixating on, I need to be strong? Because chances are they are pretty strong, but that the pelvic floor is three-dimensional. It's not just about strength.
Yeah, I think that we have a misconception of what strength is. A strong muscle group is a muscle that can fully relax and fully contract. And so I really focus on what that means. So I'll use an analogy such as your bicep. We can see it, we can feel it. If we hold our bicep up here and you decide to hold it like that all day, well, what's going to happen? Your bicep's going to get sore. It's going to feel very stiff. It might even start to change color because there's less blood flow there. So you might start to see some changes in your skin tissue. And then you go to straighten it after 12 hours of holding it like this. And that's like very hard to do. It feels contracted. It feels so tight. This is not a strong muscle. I wouldn't go to lift a baby with this arm after holding it like this all day, or lift anything, right? A strong muscle is one that can fully relax and fully contract. We want that full range of motion, because the function of the pelvic floor, like that trampoline analogy, is it has to go down in order to absorb pressure, absorb forces. It needs to lengthen to poop and pee and have penetration. And when it lengthens like a stretched rubber band, it can recoil even better. And that's a strong pelvic floor. Being tight, or what we call hypertonic, is not a strong pelvic floor. So yeah, I might do a pelvic assessment on somebody, hard to get a finger or two vaginally, have them contract, and it's already tight to start with. But when they go to contract, it's like, versus somebody who has a strong pelvic floor, genuinely insert easily, can feel kind of the buoyancy of the pelvic floor muscles, can feel like there's good lubrication, have them contract, and you get this nice squeeze and lift up and drop and down. And that's a strong pelvic floor. That's moving through the full range. And when we can move through the full range, that's where you have success. That's where you're able to integrate your pelvic floor into everything that you're doing. So that's really important to your question of how to work with pregnant women, is explaining the education behind it and why that matters, and how that's going to then impact their labor and delivery, right? How that impacts their birth story. And even for women that have cesareans, even women that are planning a cesarean, I still do pelvic floor and birth prep, because we need to soften the abdominal wall. We need to soften the side body to allow for that opening without as much constriction. And the pelvic floor is part of that, because the pelvic floor works with the abdominal wall. So it's all about creating space during pregnancy, and that's really the focus. And that doesn't mean that women can't exercise and can't move. We know the many benefits of this, but we have to have the yin and the yang, we have to have both sides of that. And especially as they get closer to birth in the last 6 to 8 weeks, I really have them pull back on practices, movements, exercises that are really only focused on the squeezing, because we want them to be able to soften and open. And that can be a hard sell sometimes. And so if I've given them the education of how this works and how that will also support them postpartum so much better than maybe tearing or having longer delivery or having to use forceps or vacuum, like because their pelvic floor is not able to let go, then it usually clicks. So it's a push and pull. It's like giving them the information to understand, but that's also kind of an entry into motherhood, because we feel like we're losing control and like we kind of tighten things in order to feel like, okay, we have control over this one thing. We work on that psychology of it too, of what does that mean? And we still can feel in control of our body and connected to our body without having to have so much tension all the time.
Right.
Yeah.
Perineal massage. It's something that's like really, really hyped up, I think, with a lot of providers, doctors, midwives. For listeners who don't know what perineal massage, it's essentially manually feeling around the perineum to kind of quote unquote stretch the tissues so that at the time of delivery, there's less likely to be tearing. Have you seen any anecdotal evidence that this works or that it's really effective and that everyone should try and do it if they can?
Yeah, such a great question. We're always trying to lead with evidence of what actually works. And the research isn't great, but we do have some research that supports perineal massage preventing grade 3 and grade 4 tearing in first-time moms. So we lean into that a lot as providers, but I also think something to be said with that, and my approach with perineal massage is we're not stretching the tissues. That's not happening. And that's not the goal. My goal when I teach women is you are connecting physically to that part of your body.
Yeah, who's aware of their perineum? Like, it's not really a part of our body we're even remotely in touch with until we give birth.
So if we can like map that, if we can go, okay, here's the perineum. Okay, this is the base of my vagina. All right, this is typically where people tear. This is what I want to soften and think about perhaps during labor and delivery. This is a place where, okay, I can do a little, like I teach the massage and I'm like, you're massaging, but you're only massaging to create a connection. And I think that's really valuable. I think that can be really valuable. But do I subscribe to like get in there and really yank around or use a perineal wand and press it down? I really don't. I mean, there are some women that want to do it, and perhaps based on their anatomy, they can't reach to their pelvic floor at 34 weeks pregnancy. So then maybe the wand is helpful. But I actually believe that the physical touch of your own fingers on your body is more valuable. But if they want to do it and they're eager to try and they can't reach, then that's the only time that I'll say, they make these perineal wands that give you an extension of your arm essentially. But it's really important that you're looking in the mirror so that you can have at least a visual connection to what's going on. Because there has to be either that sensational touch, I believe, or that visual connection as well. Yeah.
With your patients that have given birth, however the birth unfolded, how much time between them giving birth to them possibly working with you and a repairs, what would you say is suggested to be that timeline? Is it like months or?
I know. So typically, tissue healing takes 6 to 8 weeks. Which is why typically postpartum women have a follow-up with their midwife or OB at 6 weeks to check on tissue healing, right? And so that is the time that as a pelvic PT, we can do an internal pelvic floor assessment. But we know that that's a bit of an individual basis, right? Everyone heals differently. Truly typically being checked of like the uterus is coming back to where we want it to be. Everything, if you had stitches, how was that healing? How's the perineum healing? How's the cesarean healing? All of that stuff. But there's so much you can do immediately postpartum. And this is why I've just created this course that comes out next week, which is for the early weeks postpartum, the first 6 weeks. There's so much fear out there. Don't do anything, completely rest, don't do anything at all. It's like, well, you're not really. You have to get up and go to the bathroom. You have to hold your baby and nurse or feed them. You have to, for some people, if it's a second or third baby, they don't have the luxury of just being able to rest. And I'm a huge proponent. The key is rest in the first 6 weeks for healing. But how awesome would it be to know that I'm using the bathroom properly, that I'm able to do these stretches because I'm like this all day long over my baby, feeding, nursing, sleeping with them in all these different positions. So I work with women immediately postpartum, and it's not manual work, it's education again. There's so much pelvic PT that's rooted in education of like, okay, when you use the bathroom, do X, Y, and Z. When you lift your baby out of the bassinet or out of the bed with you, if they're next to you, how can you use your breath to maybe start to wake up your pelvic floor and get things moving? Also, there's such value in taking a moment to think about yourself, because it's all about the baby and it's all about what their feeding schedule is like and how they're sleeping and what's going on with them, that just having a moment every day to check in with yourself. So if something doesn't feel right, again, you can reach out for support versus what happens at 5 weeks and 6 days. And then the next day it's like, and here we are, 6 weeks, I'm ready to roll. Like now this is time to go. Like we want to start to integrate that self-awareness and check-in early on. So a long way of answering your question. It can be anytime postpartum, but the women that I work with during pregnancy, a big part of the end of their treatment is how do we prepare for the postpartum and start to integrate those practices and check-ins. And then, like I just did a virtual call with a client that was 5 days postpartum, a quick call of like, these are the things you can do. These are the things to reach out if something happens, just try this and that. And it's really supportive, but the internal work can't happen until after about 6 weeks.
Yeah, that's so helpful. What about sex? As a doula and as an educator, there's not a whole lot of public spaces for people to talk about sex after birth.
Yeah.
And how many times it just doesn't feel the same as pre-pregnancy. So how do you approach that with your patients?
Yeah, so I really guide them in a step-by-step approach of returning to intimacy. And it's rooted in, again, self-connection and education. And that is first getting comfortable with looking at their pelvic floor externally, looking at their vulva and seeing what it looks like. And hopefully they've looked at it before so they have something to compare it to.
Yeah, I can't tell you how many of my clients, they're looking down there 3 days postpartum. I'm like, why are you doing that?
I know, it's like and it's good though to be able to go like, this looks different. And then to say, but what did it look like before? I don't know. I never looked down there. It's like, we've got to create this sense of this is part of our body. Like, let's check it out. So it starts with first making sure that they're healing appropriately and getting that 6-week clearance, whatever that means. But it's when they feel ready. And so when I'm working with women and they're ready to be intimate, now, obviously there are many ways to be intimate, but when they're ready for some sort of penetration, that feels daunting. And especially after a vaginal delivery, something just came out. And how do I want something to come in? So I walk them through basically where they visualize first. They get comfortable with what that looks like. That could be once, that could be 4 times, that could be, it just depends. There's no set timeline. Then we do touch, gentle touch outside of the vulva, labia, perineum, just pressing around and getting comfortable with what that feels like. Then we go internally. Barely, just right inside of the vagina, pressing down towards the perineum, just feeling around so that they can understand what's happening in their body when they feel that touch. And then it goes into a little bit deeper, getting to the deeper layers of the pelvic floor muscles, feeling around again, what happens? And all of this along the way as they're gathering information. And if there's something that doesn't feel right, then we can stop and work through that. And then ultimately, I have them use a vibrator and see what that feels like if they're comfortable with it. If not, just use their own finger. And ideally, I'd love them to be able to orgasm before they have penetrative intercourse so that they create this connection with their body. They know they're capable of it. And it gives you a little bit more ownership of that experience prior to having intercourse. So that's like my ideal timeline. we make it yours. Some people aren't comfortable with that. Some people have a different sexual experience. Like we create and we adjust however we need to, but that's pretty ideal versus what often happens is like, okay, I got the clearance from my doctor. My partner really wants to have sex. Okay, like where can I do? Oh, it didn't feel right. I didn't like it, nothing. And it just doesn't go as smoothly. And also when you're going through that process, you're developing a language around how you can talk to your partner. And that communication is so key of like, I still have this one little spot that really hurts. It makes me anxious and nervous about, whatever it is. And over my, I don't know how many years, too long to count that I've been doing this, almost 18 years. It's really awesome when I have women that are like, my sex life is better than ever because I've never communicated so clearly with my partner. They're able to put language to something that maybe they weren't before because they're creating this connection with their body. So now they can speak about all these things and able to tell them, what position they feel less vulnerable in and how that shifts and what feels good and what doesn't feel good with some context of being postpartum, which I think is just a little bit less scary versus having that communication before having an experience like that. That's basically how we work together to build up kind of a foundation to having sex.
That's so, so helpful. You have kids, right?
I do. I have 3 kids.
Wow, amazing. So usually when I have guests that I interview, I've been asking them about their birth experience. And just because I've been having some really amazing specialists and educators, and there's so much wisdom to share, but I also want to bring a level of humanness to these conversations. So instead, I thought it would be interesting to ask you, what is something, or maybe a couple of things that you learned about giving birth, or something you learned from giving birth that you didn't quite know or expect to prepare for, or just anything really?
Yeah. Besides the fact that my husband likes to snack while I'm in labor, he thinks that I'll never forgive him for my youngest is 5. And I just vividly remember, as does he, hearing this can open as I'm in it. And I was like, are you having a LaCroix? And I'm like, oh my God. He'll never be let down for that. It's interesting. I think it's such a great question. I feel like I've learned so much in giving birth. I think a big lesson across all 3 of my birth experiences, and it progressively got more clear to me, is that to not be afraid to say what you want or how you want things.
That's such an initiation into motherhood too, asking what you want or saying what you don't want.
Right. Yeah. And not being afraid to do that. For me, I'm, a recovering people pleaser. And I think that with my first, who's now 12 and a half, obviously I was younger with him versus my third, but that transformation of really coming into, oh no, I can say this and I don't need to worry about hurting somebody's feelings that I don't want the lights on, or whatever the suggestion is, of really finding my voice. I think that's a big, big lesson that came through all my births, which is part of the excitement of giving birth. For me, it was you uncover these layers and it can feel so empowering. You feel so kind of aligned, in what it is that you want. And through that experience, I have definitely grown in that area, which I'm grateful for.
I love that.
Yeah.
Allison, this has been such an enlightening conversation. I know that you are such an amazing practitioner and educator, and thank you for being such a safe space for people to learn about their pelvic floor.
Oh, thank you. Every day I'm grateful that I get to do it. And I feel like it's such an honor. And, anybody that I get to work with or share information with, and the birth community in general, but also with clients, it's really such a gift. And I love it. I love this conversation.
Thank you so much. And how can people connect with you?
Yeah, so my website is just my name, AllisonOswald.com. And then really the only social media that I use is Instagram, because I can't handle more than one area. Then I work with clients virtually. I have a contact page on my website. And then I'm also just constantly trying to build education through my digital studio. So I have some courses and I have some just short form videos on things like perineal massage or cesarean mobilization that are just little tidbits that people can watch and practice and enhance their own pelvic floor connection.
So your online studio, people can register and take part in your courses at any point. They're not scheduled at any.
Oh, yeah. And I host webinars here and there and do special content and things like that. But the digital studio is always there and it's always growing and shifting and just trying to, fill the void. Essentially, I make videos based on what I've seen with my clients and then what people reach out for, like all those common questions. So just trying to fill that space with some good evidence-based practices and tips that support women.
Amazing. Thank you so much.
Oh, you're so welcome. Thank you for having me.
Yes, of course. Thank you so much for listening. If you enjoyed this episode, feel free to share with friends and family and stay tuned for the next episode.